Hello, I'm really excited to be here with you and guide you through this session. I'll be demonstrating the AuxaLacto Pro 30% lactic acid. We'll cover its uses, benefits, effects, and aftercare so you gain a complete understanding how to work with it safely and effectively. We'll also go through practical side, showing step by step how to apply it correctly so you can feel confident using in your own practice. This is a professional-grade superficial alpha-hydroxy acid AHA peel designed to brighten the skin, boost hydration, and refine texture. The full appointment takes around 45 minutes, including preparation and aftercare. The peel is applied in layers with an active contact time of 1 to 3 minutes per coat, never exceeding 8 minutes in total. Supplies and setup. First of all, we need the cleanser, makeup remover, papaya and CBD enzyme microfoliant plus water, SOS healing mask, optional for buffering, pre-peel degreaser, alcohol any brand, gauze or fan brush, petroleum jelly or Vaseline to protect skin barrier, timer, handheld fan, AuxaLacto Pro 30%, neutralizer, nourishing cream, and lastly SPF at least 30 plus. Also gloves, waste ball, words of to rinse, and consultation form. Next, let's cover consultation, client expectations and documentation. This step ensures clients understand the treatment, potential risk, and expected results to protect both the client and the practitioner. Client expectations. Slight redness immediately after the treatment, usually resolves in a few hours. Mild dryness or flaking for 1 to 3 days, not always. Expected outcomes: brightening, hydration, smoother texture. And be realistic on what you can achieve in one treatment. Documentation: obtain written consent, take baseline photographs, and record product details such as batch number and expiry date. I am removing all makeup, oil and sunscreen so the peel penetrates evenly. As we're doing this step, if the cleanser gets dry in the skin, don't use extra products. Instead, just add a little bit more water and carry on. I'll pat the skin fully dry before the next step. The foaming cleanser has citric acid, which is mild exfoliant to help for the peel to penetrate deeper. So if you see mild redness on the client's skin, do not panic, this is normal. Enzyme microfoliant, papaya and CBD. Emulsify the microfoliant with water to create soft paste. For sensitive skin, add extra water or pea-sized amount of SOS gel to reduce intensity, making the application gentler. This gentle enzyme helps lift dead skin cells, creating a smoother surface for more even peel. Client may feel mild tingling. Do you feel any tingling?
No, it's very pleasant. Thank you.
Massage gently for 1 to 2 minutes, concentrating on dry or flaky areas that benefits from light exfoliation, and rinse thoroughly. Conditioning. SOS Healing Mask Pre-Soothe is optional step for 2-3 minutes. This gives hydration and calms the skin so the peel is more comfortable. As soon as you apply the mask, client may feel tingling, but it's only for 30 seconds and then will pass.
My client has actually dry lips, so I'm gonna apply Vaseline on the lips as well, but it's also good practice to apply around the lips. We're gonna apply peel solution number 1. Only 2 to 3 mils, and this bottle is 50 mils, which will last about 20 to 30 clients.
Use a fan brush or gauze to apply a thin, even first coat. Work methodically, example, cheeks, forehead, chin, neck. Always monitor the client's comfort on the scale 1 to 10. After each 30 to 60 seconds, ask the client, how is the sensation now, 1 to 10. You can apply the mask now. Add further thin coats only if skin responds. Aim for uniform pink erythema with a mild blanching. If a client says more than 6 or reports sharp burning, stop and neutralize immediately. For client comfort, you can use a fan with low setting. Look for clinical endpoint cues, both visual and verbal. Do determine when to stop the treatment. Expected progressive warming tingling sensation, uniform pink erythema, mild blanching is the clinical endpoint. Aim for the client-reported sensation 3 to 5 out of 10. Stop and neutralize immediately if the client has hot spots, areas of excessive heat, gray-white patches that don't wipe away, burning, significant swelling, or tearing around the eyes. Important rules to say aloud. You never exceed 8 minutes of total contact time. Each coat typically sits 1 to 3 minutes depending on response. Do not chase white frosting. Frosting is a TCA clinical endpoint, not alpha hydroxy acid. Neutralize and rinse 1 to 2 minutes. Apply AuxaLacto Pro neutralizer generously, starting where you applied the peel first. Leave for 60 seconds to neutralize the peel. Rinse gently with water if required. Expect a brief warming sensation as the neutralizer works. What to say to the client? I'm neutralizing now. You may feel a brief warm spike followed by relief. That's normal and will pass quickly. Finally, we soothe the skin, finish the treatment, and apply SPF to protect the client. When advising clients on aftercare, make sure to cover 3 stages: immediate, first 24 to 48 hours, healing phase, days 2 to 7, and precautions for the next 7 to 14 days. For example, immediate 24 to 48 hours. Skin may feel warm, tight, normal. Avoid touching makeup for 24 hours, hot showers, saunas, swimming pools. Use only gentle cleanser and oil-free cream. Apply SPF 30+ daily. Reapply outdoors. Intense exercise causing heavy sweating for 48 hours. Healing phase days 2 to 7. Light flaking usually day 3 or 4. Do not pick. Skin may look tight, wrinkled before shedding. This is normal. Continue gentle skincare. Avoid for 7 to 14 days. Sun exposure, SPF, retinoids, products that contains AHA, alpha hydroxy acid, and BHA, beta hydroxy acid, waxing, threading. Long term, reintroduce active ingredients gradually after peeling completes 1 to 2 weeks. Repeat treatments every 4 to 6 weeks as recommended. Let your clients know that they call you if they have any worrying redness, swelling, blistering, or severe pain. Documentation and follow-up. Record treatment details, times, product patch, photos before and after, client comfort scores. Book follow-up in 4 to 6 weeks or earlier if needed. If client reports adverse signs, advise clinic visit and document. If client reports adverse signs, advise clinic visit and document. Now let's talk about complication management. What to do if a client experiences a hotspot, burning, or other unexpected reactions during the treatment. The key principle is stop the treatment immediately and respond appropriately based on the type of the reaction. Then you can go into specifics. Hotspot or severe burning, chemical peel, stop, neutralize immediately, soothe, apply cool compress, document. Severe edema, blistering, or systemic reaction, seek medical review immediately. Do not peel eyelid as a beginner. Blanching. The skin turns slightly pale or white temporarily. This is normal, expect during some treatments, like laser hair removal, and usually fades quickly. Hotspot. A small area that feels overheated or very hot to touch. This indicates too much energy in that spot and potential risk of burning. Frosting. The skin appears white and frosty, often like a thin layer of ice or sugar. This usually happens in the treatments like chemical peels or certain laser treatments. It's expected in some procedures, but should be monitored carefully. And remember, good communication with the client is the key. I hope you will enjoy performing this treatment.